My name's Dr. Beechar. I'm an experienced GP and the Director of MedLight and Medical Education. This video is about how to ask ICE in the results case in a way that sounds natural. So the way to think about asking ideas, concerns and expectations in results cases is to think about how things are before the result is given and how things change once the result is given. So the patient enters a consultation not knowing what's wrong with them. And once they learn what's wrong with them, it's very possible that they might have new ideas, concerns, or expectations in light of the new information they've been given. So you might need to ask ICE again once you've given the result. So a few general principles about asking ICE in a way that sounds natural. The best way is, of course, to follow the cues, and you don't always need to learn specific phrases. It might come out naturally in the consultation. But if you're not sure how to ask, the best thing to do is tell the patient you have a plan so that you sound like a doctor. So instead of have you thought about what's causing your symptoms, which makes it look like you maybe don't know what you're doing and makes the patient perhaps lose confidence in you, you can say, we'll have a discussion, Mrs. Smith, and work out what could be causing your symptoms, but had you had any thoughts yourself? So tell them you're going to come up with a plan before you ask the ICE. Or instead of asking what were you hoping for, which makes it look like, again, maybe you don't know your stuff, you can say, we'll talk about treatment options, but was there anything you were hoping for? So telling them that you have some treatment options in mind inspires confidence in the patient. The other thing to remember with ICE is it's really important not to lose marks for active listening. So it is good to expand on what the patient's already told you, but you must acknowledge what they've already said. So for example, if a patient wants an X-ray, simply asking what were you hoping for makes it look like you're not listening. You need to say, other than wanting an X-ray, was there anything else you were hoping for? So it's vital if you expand on the ICE and ask more that you acknowledge what the patient's already told you. Now we'll talk about how to ask ICE in results cases. So asking the ideas in the results case. So before giving the results, avoid the phrase, do you know what the results might show? That sounds extremely scripted and it sounds like you're testing the patient. Better phrases would be, has anyone explained to you what we were checking for? And have you had a chance to look at the results online? So you could use one or both of these phrases. Obviously, it's very important to reference previous consultations, and if they've already expressed ideas in the previous consultations, it's important to acknowledge those. After giving the result, you might want to ask the ideas again in some cases, because remember, in light of this new information you've given the patient, they might have further ideas. So for example, in a case of iron deficiency anemia, you might say, any thoughts yourself as to why you could be low in iron? Or you might want to check their understanding of the result. So for example, if you tell the patient they have PCOS, before explaining what this is, you might want to ask what their understanding of it is, and then fill in the gaps in their knowledge. This of course doesn't apply to every case. So for example, in the case of a positive fit test, asking ideas once you've explained the result would sound quite scripted and formulaic. So asking concerns in the results case is often better to ask once the result's been explained. Sometimes you might ask before giving the result, especially if the patient's had prior consultations for the same problem. But if the patient's never presented with this issue before, they might not know what they're worried about until they know what's wrong with them, particularly in the case of incidental findings. So if you're giving the patient an incidental unexpected finding, then after giving the results, it's good to say, do you have any worries or concerns about anything I've explained so far? So with expectations in the results case, before giving the result, it's good practice to ask, other than going through your test results today, Mrs. Smith, was there anything else you were hoping I would cover? If there's a prior consultation about the same issue, you might use that and the cues the patient's giving you in order to ask expectations. But remember, once you've given the results, the patient might have new expectations in light of the new information you've given to them. So you might say something like, now that you know your cholesterol's high, we will discuss treatment options, but was there anything you were specifically hoping I'd discuss? And it's important in some cases to acknowledge that the patient might not have had much time to think about what their expectations might be. So you might say something like, I know I've just explained your results and we'll talk about what we can do, but now that you know A, B or C, was there anything you were specifically hoping I'd talk about? So how do you get good at ICE? So like we said previously, practice in real life, see which phrases work for you, watch experienced GPs consult, and the more exposure you get to watching experienced people consult, practicing yourself and seeing which phrases work for you, the better your ICE will be, the better your interpersonal skills or relating to others skills will be, and that will help you score well in your SCA.